This is part 2. Continue to follow Ashley and Holly's journey and learn about some of the social problems they face. This is The Quiet Storm, part 2. For many years, Ashley's condition went undiagnosed. Aside from the staring seizures experienced in school as well as at home, she became very forgetful, so Tracy took her to her pediatrician for evaluation.
I was taken to her regular pediatrician. They told me that she was being a child being a child. She could be being stubborn and just trying my patience, that's what children do, and that since this was my first child, that maybe those were things I just wasn't used to, and she's growing up and she's trying to see how much she can get away with, and I just didn't think that was true.
Tracy had doubts about the pediatrician's assessment, but dealt with it until Ashley started getting headaches. Sometimes the headaches were treatable at home with medications, but other times she had to be taken to a doctor. An initial suggestion was that they were being caused by environmental factors, but that turned out to be false. Then she was told that perhaps Ashley might need eyeglasses. So she went to the eye doctor, and although the eye doctor said she may have only a slight case of lazy eye, she was given glasses. However, she was instructed to not wear them all the time. Even after getting the glasses, her headaches did not go away, and Tracy was still getting calls from Ashley's school about Ashley's odd behavior. Tracy was at a loss for what to do to help her daughter. Then at age 14, everything changed.
She was standing in the dining room. All of a sudden, and this is going from what I was told, she flipped backwards, hit her head off of a large cabinet, slid down onto the floor, and had a grand mal seizure.
Ashley was taken to the hospital after that seizure. The doctors told Tracy that there wasn't anything to worry about and everything was going to be okay. But Tracy felt different. She spoke up and said that at 18 months old, Ashley had a grand mal seizure, and since then had experienced the staring seizures. And now at 14 years old, she had another grand mal. Something indeed was wrong, and requested that she be seen by a neurologist.
The very next day, ran a bunch of tests, and she came back and she said, your child has had epilepsy probably since the day she was born, and she was left undiagnosed.
Holly received her epilepsy diagnosis soon after her first documented seizure at age 10.
I woke up and I was on the floor, and I had no idea what was going on. And I looked out, my mom was standing over me, and there were two paramedics in the hall, and I had no idea what was going on, none whatsoever. So we get to the hospital, and my mom was there, and she's like, you had a seizure, and I didn't know what that was, and I was still really disoriented. So that's when I had my first documented seizure. So mine were nocturnal. And going to the doctor and stuff like that, I finally got the diagnosis.
According to Dr. Bajic, when a person experiences 2 or more unprovoked seizures, it constitutes a clinical diagnosis of epilepsy. Even so, individuals will still have to undergo the standard testing of a brain MRI and an EEG, a brainwave test. Additionally, it is important to understand that both of these tests can be completely normal in a person with epilepsy. If that's the case, a patient might ask, how can you treat it if you can't explain it?
No matter what we do, all these gizmos and technologies will not help us explain, why a person is having epilepsy. Now, establishing that in fact person has epilepsy and answering why are completely different questions. The fact of epileptology is we can still treat patients better than really explain meticulously what's causing epilepsy in a particular case.
Treatment for epilepsy comes in many different forms. They include medication, surgery, diet, and surgical alternatives. The first and most prevalent treatment method is medication. About 2/3 of people with epilepsy have their seizures controlled with medications, and sometimes an individual is on more than one medication. Pharmacist Allison Rader has more details.
They usually choose the medication based on the type of epilepsy that you have. There's epilepsy that is focused on one area of the brain versus the entire brain. So they usually first, in diagnosis, you go to a neurologist and get an EEG or electroencephalogram, and they would kind of try to pinpoint by looking at the brain waves what type of epilepsy it is. and then they kind of start choosing the medication from there as a starting point.
About 20 medications are available for use and come in a couple different forms.
They are mostly oral medications, and there are also some liquids. There's one medication that is pretty popular in children with petit mal seizures called Zerontin. Our generic name is called ethosuximide. That one is also available as a liquid because it's mostly used for children. There's also a rescue medication called Diastat, which is a form of Valium or diazepam, and that one is given as a rectal suppository. But most of them are oral pills. A lot of those are liquid formulations for kids, and there are some IV medications if a patient has to be hospitalized.
Holly takes medication daily and has taken it since her diagnosis. She has not had a grand mal seizure since age 10 and has been free of staring seizures since 2005.
I take what's called Lamictal, and the drug's been around for maybe 10 years. And I take it at night. I take 3 tablets at night. Previously, and it works really well. Previously, I took Dilantin. Didn't get any help from that. Before that, I took Tegretol, and it turned out that I was allergic to it.
Ashley also takes medication daily. She takes a couple different kinds, and although initially they had to be adjusted because of side effects and other factors, her seizures are now well controlled, and she averages only 1 seizure every 2 months. When 2 consecutive medications do not work for a patient, it is likely that the patient and their doctor may discuss surgical alternatives for epilepsy. Discussing surgery does not mean commitment. It's only an outlook as the patient's best chance at being seizure-free.
What it means, we basically evaluate the patient. Now we use all these gizmos that we have, right? And we try to pinpoint part of the brain that is responsible for patient seizure and try to assess functions that are located close by to see how safe it is to remove that piece of the brain. If it's safe, patient gets that removed.
Long-term seizure freedom after resective surgery varies and depends on many different factors. If someone has temporal lobe epilepsy, the most common type, it is estimated that roughly 2/3 of those undergoing surgery will be seizure-free in 5 years, although some may still need to take medication. If epilepsy originates in other parts of the brain, the likelihood of being seizure-free decreases. For patients who are not candidates for resective surgery, they have another alternative treatment called vagus nerve stimulator, or VNS. VNS changes how the brain responds to seizures. It's a small device that's implanted under the skin, and electrodes are draped under the vagal nerve, which is a major input to the brain, and the device is programmable by a physician. It's unknown how this controls seizures as of yet, but it's known that it changes the threshold of seizures so a person is less likely to have one. One could go as far as calling it electrical medication. The 4th mean of treatment for epilepsy is a diet, previously called the ketogenic diet. This diet changes metabolism and is very stringent. Holly and Ashley have different types of epilepsy and live separate, productive lives. The spectrum of epilepsy is so vast that on one side, someone can be completely independent and live alone, whereas on another side, he or she must depend on caregivers.
You can have somebody with, let's say, what we call mesial temporal lobe epilepsy, who, let's say, can have a relatively low propensity for seizures and may be controlled with medication. I have a bunch of young ladies, who are delivering healthy babies, who are doing everything else, whose seizures are controlled with one single medication. So in their case, you can say they have, fully productive life. They're doing everything, and we can move on and on. I have patients who experience, who simply have no single day without seizure. And I have patients who experience multiple seizures per day.